Thank you for allowing me to participate to talk about opportunities in medical imaging for the nursing population that may be interested in joining our teams. Just quickly, I'll give myself a bit of a background description. I am the nursing supervisor, probably more widely recognized as a PCC or a patient care coordinator on most nursing units. Interventional radiology was something that I didn't know about when I finished nursing school about 20 years ago. I thought that we were sort of limited as nursings to working on medical surgical floors, or maybe if we had an interest in advancing ourselves professionally, that we would go to school and work in critical care. I finished nursing school. I worked in a medical typical style unit, moved on to intensive care, cardiac ICU downtown at St. Paul's, and then made a professional move out to Royal Columbian Hospital. And one of the first places I moved to was actually the cardiac department, working in the cardiac cath lab. And that was my first introduction to procedural nursing. After being there for about 5 or 6 years, I made a transition. Little bit of curiosity made me wonder what other job opportunities were out there, and a colleague had told me about this location called interventional radiology. I didn't know it existed, and I didn't really know what sort of opportunities would open for me. What I didn't realize was that the growth, education, professional advancement, and to be honest, the team environment that we work in was nothing that I expected I would find, and feel pretty fortunate that I have. I've been in the supervisory role for almost 3 years now. I joined the team as a frontline nurse and really appreciated quite quickly how cohesive our department works together. We work alongside MRTs, and as a nurse in this department, there really is no role that is more important than one another. Here at Royal Columbian Hospital, we are the level 1 stroke center for the Fraser Valley, and taking care of patients who, like I said, are having strokes, pulmonary embolisms, traumas, and something as relatively straightforward as a nephrourostomy tube change. So there is no procedure that sort of takes a greater importance than one another. But what our department really does do is service a very fast-paced, growing population out here in the Fraser Valley with a wide spectrum of needs, medical, sort of diverse and sometimes complicated medical needs. And I really appreciate the role that I'm able to play in that team setting. So, what this role has given for me here in nursing and for my colleagues is a real sense of autonomy, and, like I said, a team environment where we work really cohesively together. There are a variety of roles that are currently available in our department right now, so I'm always really excited to be able to participate in these sorts of opportunities. We will, in the next year, just over a year, be moving to the Jimmy Pattison Acute Care Tower, where we will move from 2 procedural rooms to 5. So the desire to have conversations with possible interested applicants is something that's always at the front of mind for me. A new opportunity that we just created this past late summer, early fall, was an opportunity to sponsor possible applicants to move into the Fraser Health endorsed high acuity training program. And we actually have a current applicant that has just started this past week. So we hired her from a medical surgical role and have endorsed her into the program. She will return to us just before Christmas, and she will have that certification behind her, and she will join our team. So, I think that the current landscape indicates that we need motivated, interested individuals. Obviously, my interest is in nursing, but I would love the opportunity to speak to anyone that possibly is interested, or you can reach out to recruitment as well to get a hold of us. Thank you.